Hi, welcome to the Twitch Dry Needling video training series, where I'll share your fantastic dry needling technique followed by a manual therapy technique to get great results for your patients every time. Okay, one of the most common presentations that we see in practice as manual therapists is patients who come in with neck pain, headaches or shoulder tension. And we're all guilty of just looking at the back of the neck. We look at the suboccipitals, cervicorectal spinae, trapezius. But in those cases where you've got lingering problems, chronic problems, not really resolving, always have a look at two other muscles, the longus colli and the sterno-cleidomastoid. Have a look at those two muscles, whether they're lingering or not. In fact, they're going to get you great results, not just looking at the back of the neck. So let's have a look at needling to sterno-cleidomastoid first and then follow up with a manual therapy technique. So let's have a look at that. Okay, so looking at sterno-cleidomastoid, that's often loaded up with trigger points here because it's often very tense and gets very good results once you have needled this muscle. Once we've needled that, what else can we do as a manual therapy technique? Let's have a look at this sterno-cleidomastoid just in here, and this is a great technique here just for out that sterno-cleidomastoid. You're either side of the belly here when the two heads of sterno-cleidomastoid have joined up, and we're here just on the mastoid process either side. We're now stretching like that. Really very nice technique with some rotation and side bending. You can see that stretching along here. Very nice just in here. Okay, that's going to be a great technique for you to do after you've needled sterno-cleidomastoid and get great results for those stubborn neck pain, shoulder pain and headache patients. Hope that helps.